Hi, I'm Dr. Gregg Carb, and this video is foam roller stretching for chronic low back pain. As a reminder, remember to check with your healthcare provider before starting or changing an exercise program. As everyone knows, low back pain is very common. In 35 years of practice, I've worked with low back pain patients on a daily basis, and as we will soon see, I myself, unfortunately, have low back issues. Let me show you what I mean. This is a side view of the lower back, and there are 5 lumbar vertebrae. In this model, the red arrow is pointing at the front of a normal L5 disc. From the side view, this is what a normal L5 disc looks like on an MRI. And the red arrow here is pointing at my L5 disc, which is severely degenerated and often painful. To help manage chronic low back pain, among other things, I both use and recommend a 5-minute foam roller stretching routine that will be presented here in a moment. First, you should be aware of any red flags for back pain. If you do have low back pain with fever, any weakness, weight loss, a change in bathroom habits, persistent radiating pain into one or both legs, or night pain while at rest, you need to see your healthcare provider as soon as possible. With that out of the way, let's review some guidelines for the foam roller stretching for chronic low back pain. If you have acute low back pain, you probably need to repeatedly apply cold and over-the-counter medications, consider wearing a back support, keep a neutral posture as much as possible, rest by laying flat on your back with your knees up, and avoid too much activity or too much stretching for several days. Moderate everything. Okay, for chronic low back pain, we are going to use a standard foam roller, which is 6 inches in diameter and 36 inches in length. If you are not familiar with a high-density foam roller, they are quite firm, and you may need to pad your roller. Only stretch as far as you are comfortable. This is not competitive stretching. Start out easy and try to stretch a little more with each count, with a little bounce at the end. Your position on the roller for these stretches is very important. The roller will need to be positioned on your pelvis just below your belt line, which is just below this prominent landmark marked red, which is called the PSIS, posterior superior iliac spine, also shown here on this spinal model. From the side view, you can see how this PSIS sticks out, so it should be easy to find. Just below the PSIS landmark is a flat bone called the sacrum. That is where you want the roller to be. So your pelvis should be up on the roller like this, and your shoulders should be down on the floor like this. And your pelvis up on the roller and your shoulders down on the floor helps to lightly stretch or traction your lower back, which should feel good. If not, try rolling slightly up or slightly down from your position on the roller to see if it feels a little better. If not, try again some other day. You may need to reposition yourself on the roller from time to time while doing the different stretches. So let's review each stretch one at a time and then go through the whole program without interruption. To start, balance your pelvis on the roller as shown. With your knees bent, rock your pelvis back and forth on top of the roller 12 times. Place one foot on the ground and then straighten the other leg and bounce 6 times, and then switch legs and bounce 6 times. Repeat the same stretch now using both legs together at the same time, with a slight ab crunch at the end of each bounce for 12 times. Bend both knees and legs into a butterfly stretch and bounce 6 times. And then straighten out your legs and repeat the same stretch 6 times. Return to an upright position on the roller and hold the ends of the roller, and then roll your pelvis across the top of the roller to the right and left sides 12 times. Roll onto one hip and then straighten out the top leg and reach out with your leg and bounce 12 times. Repeat on the other side also for 12 times. Return to an upright position, hold the ends of the roller, put one leg into a figure 4 position and bounce your knee down 12 times. Then, while still in the figure 4 position, flex both hips toward your chest and bounce 12 times. Then, from the figure 4 position, raise one heel above the opposite knee and then rotate your thigh inward so your foot travels away from the center toward the outside and bounce 6 times. Repeat these stretches on the other side as well. Flex one hip toward your chest with the knee bent while straightening the opposite leg and dropping it down, and bounce 12 times. Repeat on the other side. Place both feet flat on the floor and reach overhead with both arms. Pull one arm over to the side and bounce 12 times, and then repeat on the other side. Push the foam roller forward and hold the ends with your hands. Slightly widen your feet apart. Perform an upward plank that raises your hips about an inch or two up the roller and bounce 12 times. From a position on your hands and knees, place the roller under your hands. Push the roller forward as you lower your body, reaching out with your arms and pushing back with your hips at the same time, and bounce 12 times. Put the roller up on one end and place both hands on top while in a lunge position, using the roller to support your weight. Lunge forward and bounce 12 times. Repeat on the other side. Stand and spread your legs out and then lean forward at the waist and place both hands on the end of the roller. Your two legs and the roller should form a tripod. Allow your weight to be supported by the roller while you reach forward with your arms and push backward with your hips at the same time and bounce 12 times. This foam roller stretching routine for chronic low back pain should be performed 2 to 3 times daily for best results. One other comment, you would likely benefit from stretching your mid-back as well because the flexibility in the mid-back is a prerequisite for good posture and overall spine mobility. That relates quite directly to the whole spine. Mid-back rolling is covered in other videos on this YouTube channel.